About hypnosis, when we look around, we see there are some myths, misbeliefs, and some believe it's a magical method, and they are confused about what hypnosis is. Is it a state of consciousness, state of sleep, and is it dangerous? They have these questions in their minds, and Alpa's definition of hypnosis: it's a state of consciousness but different. It involves focused attention and reduced peripheral awareness, characterized by an enhanced capacity for response to suggestions. And the terms about hypnosis, let me start with them, because we don't know those terms very well. Can you really hypnotize someone? How can you tell if someone is in hypnosis? That song is so hypnotic. Do you want to do hypnosis or be hypnotic? And I'm not a hypnotist or a hypnotherapist. It is just one of the methods that we use. I'm a hypnotherapist. This is what we say as a better term. And you can see the watches swinging in front of our eyes. It is a method of hypnotic induction. It just starts the hypnosis, induces hypnosis. And it is the process by which one person leads another into hypnosis. And it's not necessary to swing watch in front of eyes or say you are feeling sleepy to hypnotize someone, but it will increase the attention and facilitate hypnosis. What about hypnosability? The differences in the ability of people to become hypnotized. Low hypnotizability, 10% high hypnotizability, moderate hypnotizability is a lot higher. Reliable and valid instruments for measuring hypnotizability, Stanford and Harvard group scales can be used. And looking at the historical development of hypnotizability, they said maybe personality characteristics may change susceptibility to hypnotizability, but the studies do not confirm this, and they ask whether there is a gender difference in terms of hypnotizability, but no difference was found. In 1970s, there is a study actually that in the productive period, hypnotizability may be higher in women, but that is because women spend more time at home and with their children, and I haven't seen any other study which repeated this result. So is hypnotizability a characteristic that we have from birth, or is it modifiable? So is it like a trait-like ability? And theoreticians say that it is a trait-like ability, but more recent and more behavioral and more cognitive theoreticians say that it can be modified, so it is something modifiable and it can be improved. And they organize trainings to that end. By 50%, hypnotizability was shown to be modifiable. So why use hypnosis when there are other methods, NRT, nicotine replacement therapies, and many pharmacotherapy options and other approaches? Why use hypnosis rather than others? There is a data from a study in 2006, a very comprehensive survey, and 80% of smokers said they wanted to quit smoking, and 26% of them wanted hypnosis. They were female gender and higher education. So female gender and higher education was found to be positively related with a higher preference for non-evidence-based interventions. And the individuals with pulmonary cancer in family history also preferred hypnosis. In another study, only 16% of participants believed that NRT could help people quit smoking, and 26% of them feared the side effects of this treatment. This is what they call cold turkey, quitting on your own. People believe they can do this, but the success rate is only 5 or 6%. And smokers may attribute nicotine withdrawal symptoms to NRT, believing them to be medication side effects, and the risk of addiction to nicotine is a possible detriment of NRT, and there are other false beliefs that nicotine is a major cause of tobacco-related health problems, so that's why they may prefer these different therapies. So is hypnosis really effective? Should we use it? There is a great variability in quit rates, ranging from 4 to 80% 6 months after the treatment in multiple studies. So it is a great variability depending on the type of hypnosis, maybe frequency, intensity, and experimental methodology issues. Maybe these are the sources of such differences. Cochrane review from 2010 is very detailed. All studies from 1970s were included. In this first slide, there's a comparison of hypnotherapy versus brief attention cessation advice. And here you can see there's not much of a difference. 5 studies are included starting from 1970s. And then Henderson's study from 1979, there was found to be a difference there actually. And that difference may be due to a biased publication problem. So they didn't find it to be a meaningful difference. So in general, hypnotherapy versus brief attention and cessation advice was not found to be effective. And hypnotherapy versus psychological treatment, phone calls, follow-up, there wasn't a difference. Then hypnotherapy was compared to rapid focus smoking. 2 studies from 1970s and 80s. There isn't much of a difference. The sample size is very small. Hypnotherapy versus drug. Just 1 study from 1977. Not much difference. Placebo versus hypnotherapy, no difference. And other treatments. Some of these studies are important. Other treatments were also compared. In general, it is significant because all the studies up to that period only included the randomized controlled studies, and with 6 months of follow-up and with 7 days of smoke-free. So when you include studies of a certain design, it shows that hypnosis is not superior to other treatments. Another study from 2006 by Elkim, only 20 participants, to either an intensive hypnotherapy condition or to a waitlist control condition. At the 3 and 6 month follow-up, 40 to 50% success rate. Another study, 2008, 286 smokers, 2 6-minute sessions of hypnosis, and at 12 months, 20% of the hypnosis participants were found to be successful in quitting. And people with depression history exhibited higher quit rates. And another study after 2010, is there any more recent study? Yes, from 2014 there's a study, NRT for one group, another group 90-minute hypnotherapy, and a third group NRT with hypnotherapy. A 12 mixed hypnotherapy group 43.9%, NRT group 28.2%. Hypnotherapy NRT combination group abstinence rates were similar to hypnotherapy group. Another study, 2017, 102 participants, 35% for hypnosis group quit rate, 42% behavioral counseling group quit rate. So in the literature there are very contradictory studies and contradictory data. So to sum up these studies and reviews, we can say that clinicians can accurately inform patients that 22 to 35% rate of success is there for hypnosis. So what improves the success rate for hypnosis? It was generally single session and just 10 minutes, but it was said that this wouldn't be sufficient, so there should be multiple sessions, individualized hypnotic suggestions, and individualized counseling with follow-up and intense interpersonal relationship, and minimum 10-minute session length. Another study from China from 2010, here they look at the effect of hypnosis on the brain for smoking. fMRI in one group, EEG in the other group. In the control period, the values were checked, and also in the hypnotic process after the suggestion, the values were checked. Right dorsolateral prefrontal cortex and insula were more active during the hypnotic phase rather than the control period. Insula actually is associated with disgust, but also it is associated with craving for smoking. The hypnotic suggestions used here were focusing on disgusts, enabling disgust from smoking. So can we explain this activation by disgust or craving? We are not sure. But hypnotic suggestions related craving was found to decrease in this study.
Bu hipnozu aslında biraz daha örneklerle götürmeye çalışacağım.
What happens in a hypnosis session? First of all, we start with eye focus induction, then relaxation, comfort, relaxation from head to toe. We want the patient to feel comfortable, peaceful. Mental imagery may be used for relaxation. Then commitment for smoking cessation, like making a commitment. From now on, you quit smoking, you are not a smoker, you are starting a new life. So we help them make commitments. If there's a dissociation, then we help dissociation from cravings. If there's a craving, then as you go deeper in hypnosis, We may make suggestions that the craving is at the superficial level now, and post-hypnotic suggestions is important. We should tell the patient that she won't put on weight anymore, and everything will be more tasty, and the smells will be nicer to her. Self-hypnosis is again very important. After you teach this method, we can ask her to self-practice it at home. We give some keywords. Every time you want to smoke, want to smoke, say stop. I don't want to smoke. So any keyword that will be good for the patient to remember when she or he craves for smoking. Then positive imagery for benefits of smoking cessation. Imagine the times when he or she is no longer smoking, breathing better and running better, swimming, maybe a positive image about the future, and then alerting. And the most commonly used metaphor for hypnosis is feeling alive and starting a new life.